This conference will now be recorded.
Good morning. Am I audible? Good morning,
Yes, sir.
everybody. Okay, fine. Okay, we'll start off with today's class. Today is an important topic as far as your exams are concerned. You will be having a short note usually on this particular topic. It will be for four marks. Usually ocular manifestations of tuberculosis or vitamin A deficiency or HIV, AIDS. Out of these three, one question will definitely be asked. So we have seen various parts of the eye like lids, cornea, conjunctiva. We have dealt with various chapters in detail. Now we will be just what you call accumulating, or we will be trying to highlight the features which tuberculosis can cause in each segment of the eye, in the anterior segment and in the posterior segment. We must have covered all these features when we were dealing with individual topic like lids and cornea and uvea, retina, choroid, vitreous. Each topic when we were dealing, we must have thrown some light on this particular manifestation of tuberculosis in the eye. We will be just putting all those points in one single section, that is ocular manifestations of tuberculosis. So what are the ocular manifestations of tuberculosis? So we'll start off with today's class, ocular manifestations of tuberculosis. Usually, they can be classified into 5 different forms. One is adnexal manifestations, second one is anterior segment manifestations, posterior segment manifestations, neuro-ophthalmic manifestations, drug-related ocular toxicity. Can anyone tell any manifestations of tuberculosis in any part of the eye? Anybody? Can you give me some 2-3 answers? Anybody? Please don't see your book. Whatever you have learned till now, or whatever you have heard till now, you can just tell few manifestations. Anybody? Anybody? See, looks like nobody is there. Everybody has just logged in and gone. Fine. Adnexal manifestations, anterior segment manifestations, posterior segment manifestations, neuro-ophthalmic manifestations, and drug-related ocular toxicity. What are the drugs used for tuberculosis, treatment of tuberculosis? Can anyone tell? Nobody's answering.
Isoniazid.
Isoniazid,
Okay, fine. Isoniazid, yes. Then
ethambutol, pyrethrum,
very good. Ethambutol, yes. Then isoniazid,
Rifampicin.
rifampicin, good. Yes. Then one more.
Pyritinamide.
Repeat. Can you repeat?
pyrethamine.
Pyrazinamide. Can you repeat those 4 drugs? INH, ethambutol, rifampicin,
Isoniazid, despampacin, pyrazinamide.
pyrazinamide. Yes. So there are toxicities related to these drugs in the eye. Can anyone tell any neuro-ophthalmic manifestation or posterior segment manifestation or anterior segment manifestation? in the eye, anything, whatever comes to your mind. Which tuberculosis is a chronic disease. It's a granulomatous disease. There is granuloma formation. So what are the manifestations in the eye? From whatever you have learned in various chapters, you must have come across this term in almost all the chapters: tuberculosis of the lid, tuberculosis of the cornea, tuberculosis of the uvea. So what and all manifestation it can cause in various parts of the eye? Anything, any one manifestation you can tell. Suppose let us take uvea. What does it cause in uvea? What does it cause in uvea? Or what does it cause in posterior segment? Okay, we'll go forward from here. So now this is an example of a lid manifestation of tuberculosis. So on diascopy, it shows apple jelly color. So this is an example of tubercular manifestation in the lid. What is this diascopy? When you press on the lesion with a glass slide or with your finger, it shows blanching. So that is called as diascopy, and it shows apple jelly color. So this is one of the most important manifestation of the lid in tuberculosis, lupus vulgaris. Then coming to other eyelid manifestations, the patient can have granuloma. This is small swelling of the upper eyelid, which mimics something like a chalazion. So in the lower eyelid also, the characteristic manifestation is it usually ulcerates. Okay, so this is the characteristic manifestation as far as tuberculous granuloma is concerned. From the lids, we will go into adnexal part, the lacrimal gland. Here, the lacrimal gland is present, and there can be tuberculosis of lacrimal gland, and that is called as dacryoadenitis. So this is one of the manifestation of lids and adnexae in cases of tuberculosis. Sometimes there can be a syndrome called as Parinaud's oculoglandular syndrome. Oculoglandular means eye and a gland is involved. The parotid gland and the eye is involved. Chronic conjunctivitis, you can see redness of the eye here. Chronic conjunctivitis along with swelling of the parotid gland, you label it as Parinaud's oculoglandular syndrome. So this is one of the manifestation as far as conjunctival manifestations is concerned about tuberculosis. In the conjunctiva, there can be a granuloma formation in the lids. If you just pull the lid margin forward and you look in the fornix, you can come across this particular type of lesion. This is called as conjunctival granuloma. You have to just remember these names. If a question is asked in the exam regarding what are the ocular manifestations of tuberculosis, you have to divide the ocular manifestations in under various headings like lids and adnexae, conjunctiva, cornea, anterior chamber or uvea, lens, lenticular changes, vitreous changes, posterior segment changes, retina, choroid, optic nerve. So under these various headings, if you remember at least one manifestation, that should be sufficient for you to answer the question. So now we have come to conjunctiva. Conjunctiva shows conjunctival granuloma. So in conjunctiva, there can be another manifestation called as Phlyctenular Keratitis or Phlyctenular Keratoconjunctivitis. It is an allergic reaction which is commonly seen near the limbus. You can see here, this is the name given to a game given as Phlyctenular Keratitis. Phlyctenular means a vesicle-like swelling. Phlycten, the word meaning means a vesicle or a bulle or a swelling which is seen close to the limbus. So there are various types of Phlyctenular keratitis. You must have read those in the chapter conjunctiva. There is a fascicular type, sacrophilous type, and a miliary type under ulcerative Phlyctenular keratitis, and there is a diffuse nodular or diffuse Phlyctenular keratoconjunctivitis. Basically, broadly, Phlyctenular keratoconjunctivitis is divided into two main types: ulcerative and diffuse. In ulcerative, there are further three types: miliary, fascicular, and sacrophilous. So usually they are commonly seen along the limbal border, and there is vascularization. So if the vascularization is progressing along the limbus, then it is called as fascicular, and if it is sacrophilous, you see a nodule or a ulceration in the cornea, which is seen close to the lid margin. So, and miliary is multiple small dots which are seen along the limbal border. Like here you can see there is a small lesion, here there is a small lesion. This is commonly seen as an allergic reaction to tuberculosis or tubercular proteins and tubercular antigen. So here the treatment is mainly topical steroids. And topical steroids is usually sufficient. If pain is present, you can give atropine with the coverage of antibiotics, but usually topical steroids and atropine is sufficient. There is no need to give ATT, anti-tubercular drugs. But if the MANTO test is positive, then probably you have to proceed with ATT. Usually this is an allergic form of reaction which we commonly come across. So the name given for this is Phlyctenular Keratoconjunctivitis. Kerato means cornea, conjunctiva means this reddish region. So when both cornea and conjunctiva are involved, it is keratoconjunctivitis. You can see here there are various forms of Phlyctenular keratitis. You can see here there is a vesicle here with surrounding redness. Similarly here, and this is here where the cornea is involved. This is the stage. Once this has healed, it has led to the formation of opacity or faint opacity. You can see here the fascicular variety of keratoconjunctivitis, the blood vessels growing, superficial blood vessels growing from conjunctiva onto the cornea, and you can see a whitish patch here forming an opacity. So all these are various types of Phlyctenular keratitis. It is a vesicular type of lesion. Next, coming to cornea, interstitial keratitis. You can see here, this is an example of interstitial keratitis. Cornea has 5 layers or 6 layers, you can say now. 5 anterior epithelium, Bowman's membrane, stroma, and descemet, pre-descemet membrane, descemet membrane, and endothelium. So when the stromal tissue is involved, or haziness of the stroma is present, then you call it as interstitial keratitis. Interstitial keratitis is one presentation which is commonly seen in chronic diseases like syphilis, and there are various non-syphilitic conditions like parasitic diseases and tuberculosis, leprosy, and so on. But the most common thing or common condition which you have to rule out is tubercular interstitial keratitis. You can see here the cornea is pretty hazy. It is not clear. The interstitium is involved. In interstitial keratitis, the cornea epithelium is not affected and endothelium is not affected. Only the stroma is affected. Tubercular scleritis. When the sclera is inflamed, the patient is having scleritis. It could be nodular scleritis or diffuse scleritis. So tubercular scleritis is one classic example. You can see in the picture, the sclera is involved here. Here, for all these conditions, the medication is topical steroids with the painkillers or analgesics with along with the atropine. But if ATT has to be started, it has to be MANTO test has to be done, and tuberculosis has to be confirmed before starting ATT. Coming to uveal tissue, if you can see here, There are various manifestations of uveitis. This is a chronic granulomatous type of uveitis. You can see here there are mutton fat capes, posterior synechiae, and there is busakas or kepes nodules here, and a lot of mutton fat capes. You can see here big capes. Capes are nothing but keratic precipitates which are present on the endothelial side of the cornea. So it is a classic manifestation of tubercular granulomatous uveitis. It's a chronic uveitis which usually the patients present, and uveitis related complications are usually seen in these patients. From anterior segment, now we will go into the ciliary body region. In the pars plana region, the patient can have intermediate uveitis, and this is the area which is affected in intermediate uveitis, the middle part of the uvea. And you can see snow banking. Snow banking is nothing but you can see various exudates in accumulating along the pars plana region or in the ora serrata region, snow bank or snowballs, which are commonly seen here. In when you try to do an indirect ophthalmoscopy, you see this hazy opacities near the pars plana region or near the ora serrata region. In the macula there can be edema, and that is called as cystoid macular edema. So this is one of the manifestations of tuberculosis, that is intermediate uveitis. Now coming to the posterior segment. In the posterior segment, we come across various types of manifestation. Most common is choroidal tubercles. You can see this behind the retina there is choroid, or the uveal tissue behind the retina is called the choroid. And the choroid, there can be tubercles, yellowish patchy lesions. How do you know they are deeper? You can see the blood vessels running above the patches, white yellowish patch. Now this is the optic disc, these are the vessels, this is the vein, and this is the artery, and this is the macula, and you can see the blood vessel running above the yellowish patches. So you come across these type of yellowish tubercles or yellowish tubercles in tubercular conditions. Now, this is another example of choroidal tubercles. You can see a deep lesion is present, a choroidal tubercle, which is commonly seen in tuberculosis. And you can see various types of folds running here like this. There are wavy type of folds which are running here. This is nothing but ILM folds, or internal limiting membrane folds, which are commonly seen in the retinal layers. So it is the most common lesion which you come across in tuberculosis in the retina and the choroid is tuberculoma, choroidal tuberculoma. Miliary tuberculosis is a classic example of tuberculosis. You can see multiple white lesions in the choroid of the patient. So this is an example of miliary tuberculosis, where you come across miliary tubercles of choroid. Now this is another manifestation which we commonly come across in tuberculosis, that is serpiginous choroidopathy. Serpiginous means it's something like a snake. You can see the yellowish patchy lesion. They proceed along the arcades of the blood vessels. They proceed along the arcades of the blood vessels. The etiology was unknown for quite a long time. Now this is a fundus picture of a 21-year-old patient who was positive for MAN2, and in the fundus there were lesions like this. And there was no history of pulmonary tuberculosis, and lesions these over a period of time there is an atrophy in this particular region with active choroidal lesions and satellite lesions. And when you do a fluorescent angiography, you see both hyper and hypofluorescence on angiography. So this is a classic example of tuberculosis which is commonly seen in young patients, serpiginous choroidopathy. Sometimes there can be accumulation of pus in the retina or in the subretinal space. So this is how it appears if there is accumulation of pus. So that is called as subretinal abscess. So this is one of the common manifestation which we come across in chronic tuberculosis. Now this is vasculitis. Vasculitis is nothing but inflammation of the arteries, and there is hemorrhages around the arteries and bleeding is present. Vasculitis is commonly seen in cases of retinal in retinal layers in cases of tuberculosis. Whenever you see vasculitis, one thing what you have to rule out is tuberculosis. Another condition which is commonly been associated with tuberculosis is, or tubercular antigen is, Eales disease. This is also one condition which is commonly associated with tuberculosis. Coming to optic disc finding, you can see the disc margins are not clear. If you see here in this picture, and disc margins are clear cut. You can see here disc margins are clear cut. So when you come to this picture, you see the margins are blurred. So there is swelling of the disc which is present. It could be papilledema or it could be optic disc edema, which is commonly seen or associated finding in case of tuberculosis. So we have come across various types of findings in tuberculosis, starting from lids, apple jelly color lupus vulgaris, eyelid tuberculosis, granuloma, dacryoadenitis, Parinaud's oculoglandular syndrome, conjunctival granuloma, Phlyctenular keratoconjunctivitis, interstitial keratitis, tubercular scleritis, granulomatous uveitis, intermediate uveitis, choroidal tubercles, choroidal tuberculoma. Here there are multiple white yellowish patchy lesions, so it is called as tubercles. When there is one single lesion, it is called as tuberculoma. Then miliary tuberculosis and multiple lesions are there, then you call it as miliary tuberculosis. Serpiginous choroidopathy is another classic presentation. Subretinal abscess is another presentation. Retinal vasculitis is another presentation where the vessels are involved, which is associated with bleeding and vitreous hemorrhage, and inflammation of the retina or retinochoroiditis is present. And in the disc, patient can have disc edema, so or involvement of the disc, optic disc granuloma is another. These are some of the common associations with tuberculosis disease per se. During treatment, patient can have these particular types of problems like optic neuritis. Drug induced optic neuritis with ethambutol is most common presentation. INH and rifampicin also induce optic neuritis, but most common is ethambutol. The photophobia and extraocular muscle paralysis, that is paralysis of extraocular muscle, color vision abnormalities and visual field defects are some of the common presentations which are associated with ethambutol toxicity. So these are some of the manifestations of tuberculosis or ocular manifestations of tuberculosis which you have to remember. This is a short note question which will be usually asked for you in the examination, and definitely such questions will, one question is likely to pop up, whether ocular manifestations of HIV or ocular manifestations of tuberculosis or ocular manifestations of vitamin A deficiency. Out of these three, one question definitely will be asked in the exam. So kindly go through your textbooks and read these particular topics. If you have any clarifications, you can always revert back to us. So with this, we complete this topic on ocular tuberculosis. Do you have any clarifications? If you have any clarifications, you can ask. No clarifications? Okay, we'll end the class here. Thank you.